Good afternoon, East Brunswick residents. As promised, I'd like to continue giving people updates on the epidemic and pandemic that we're facing here, not across only East Brunswick, but our state and the nation and the world as a whole. But I want to take it down to information that is important to those of us that live here in East Brunswick. And one of the things that I see constantly being thrown in front of our faces is data. And data and data and data. And many times it's so much information being thrown at us that we really don't even know what to make of it. And that kind of takes me back to medical school. My wife and I entered medical school in 1982. And at the time, we were so thrilled to be there. We wanted to really get into to medicine, and we wanted to excited about our gross anatomy classes and about the interesting topics and meaty topics that we would get to do. And yet, at the same time, back in 1982 when we started, so I'm kind of dating myself here, we were supposed to take required course in epidemiology. It was kind of a sleeper. Most of the people that were in the class, you can kind of divide them half and half. Half of them you could tell were on their fifth or sixth cup of coffee just to stay awake. And the other half had clearly taken their Ambien because they were out. Truth in being told, Ambien actually wasn't developed till many years later. But in any event, what was interesting is that who would have thought that 30 to 40 years later, I would be watching national news and press conferences where I actually can't wait for in the middle of a crisis for the leader of the free world to simply just step off the stage along with his bobbleheads that keep agreeing with him, or I can't wait for the news media that just are filled with gotcha questions that really don't move the conversation forward, and that at this point in time, I'm actually waiting to hear from epidemiologists to learn about the numbers and the science that help us figure out how we're going to see ourselves out of this crisis. And it's the data that East Brunswick residents keep requesting from me. And I've been very, very reluctant to give updates on a daily basis because data, in order for it to be really, really useful, has to fulfill several requirements. It needs to be accurate, it needs to be timely, it needs to be actionable, and you have to have enough data points, a large enough sample, so that you can actually make conclusions with any degree of significance. So as of last evening, 269 cases, COVID positive cases here in East Brunswick is simply not enough data points to really make that much information from which you can draw conclusions. It's part of a data point to help us with county data now that they're up to a little over 6,000 cases, or the state, which is over about 68,000 cases, or national statistics where we're sitting at around 600,000 positive COVID cases. So in all honesty, we need to look at each one of those three areas: accuracy, timeliness, and the actionableness of the data, in order to see why the East Brunswick data, which I will present to you here at the end, has its problems. So first, let's look at accuracy. We do have some accuracy. Our data that we've been providing to East Brunswick residents comes directly from the county information. Our officer responsible for OEM, John Cossack, gets information from the county on a daily basis. And that information is riffed with some areas of concern over the accuracy. Information coming out of hospitals, information coming back down to us from the state, information coming from nursing homes and assisted living facilities, rehab centers, and doctors' offices all take a circuitous route till it finally gets down to us. death statistics was one of the most glaring. I noticed that over this weekend when clearly there were people who unfortunately passed away at some of our assisted living and rehab centers were not reported to East Brunswick. And that can happen for many reasons. Sometimes someone dies at a hospital, the information trickles up to the state has to bring it down to the county then gives it to us. That's a lot of time lag in between that information reaching my lips to be able to give that to the rest of the community. We also have a problem in many of those facilities, rehab centers and assisted living, where people that live there may not necessarily list their home address as being East Brunswick, but they were living there while they were in assisted living. And so the information may trickle to a different town and not back to East Brunswick. The COVID list alone that is provided to John Cossack each day and to myself has inaccuracies that we've noticed. In some instances, they'll give an address, but when you actually drill it down, the address isn't even East Brunswick. Or we found that there's times when there's been double counting, or we're given information but not complete information. We may be given an age but not the gender. We may be given the gender but not, is the person hospitalized? We really don't know all of that, and so the information we give to you has a level of inaccuracy that's built into that, unfortunately. We're also looking at the timeliness of the data. That's another area where statistics can go awry. We have a problem, again, as I mentioned earlier, getting death certificates or statistics for East Brunswick. And I don't believe that that's a problem just for East Brunswick. I think that that's a problem in the processing of information from where the person expires to providing it to the state and trickling it down to the townships. There's been a big lag and a lot of problems with that data coming directly to the town. COVID testing itself, which test did you get done? Now there's a 24 to 48 hour saliva test. And there's some tests that in the past have been 5 to 7 day turnaround, others that were even longer. Sometimes labs have difficulty. They're laying low on the number of people processing some of these tests, so the data comes in spurts, like in data dumps, as opposed to exactly at the time in which it was received. And then, as I mentioned earlier, there's a delay in transmission. As a physician, I'm required to report COVID cases to the state. The state agencies and testing centers report it to the state. County results come to the county. Then it goes up to the county and then back down to the township. It's a process, again, that takes many days, and since there's a difference between all of those processing times, the daily reflection of cases may have anything to do with the amount of disease, but more in the manner in which it was processed and how long it took to get to us. And then, is the information actionable? What does the number of cases actually mean? When you look at the news and you look at that big bell-shaped curve and it looks like total cases, whether it's a daily case or the total, that doesn't take in, that's just the number of people who have COVID positive cases. Most people, as we learned, are asymptomatic carriers. They don't have any symptoms. They don't even know that they're carrying it. And so there's no reason to test them. We don't even know that number. That's probably the largest. There's many people who have the virus and they're not being tested. Friends of mine who have clearly had symptoms called up their doctor's office, gave their symptoms. The doctor said, you know what, don't come to my office. Either I don't have hours or I don't want people waiting in the waiting room with COVID. Or if you really feel like you're sick enough, then you should go to the hospital. But unless you're one of those categories, early on in this process, we had really a limited number of places to test. So a lot of those people went completely untested. So we have to keep in mind that many people who have the disease are never going to be accounted for. So that number you will never know. And that problem hopefully gets a little bit better as we have more testing available, but it's still the number of people with disease compared to the number diagnosed is grossly larger than the number of people diagnosed. We also have people asking me, What's the percentage or the number of people that are getting better? I want some good information. I was actually on a county call just a couple of days ago where one of the mayors, I forget which town it's from, it doesn't really matter, he asked, well, what's the number of people that got better? Is the county doing anything to follow up on people that were diagnosed to see what's happening to them? Folks, there's only two outcomes to this COVID viral infection. The vast majority of people are going to get better. Unless the only other outcome that's left is death. That's the only outcome and that's the only one for which we have accurate statistics. But the vast majority of people are going to get better. They're either going to have the disease and stay home and get better, which is most people. They may end up going to the hospital but get better and be discharged. They may end up going to the hospital and need respiratory support, but then get better and get discharged. At the end of the day, the only outcome is you get better, which is almost all of us, or you die of the disease. And that's what we're looking to try to prevent. And we do that by keeping people at home, preventing the spread of infection to begin with. So is the data, is that what would be the point of sending all of our county health inspectors to make phone calls to all these people to find out how they're doing? That would be a colossal waste of manpower, and it would be information that really doesn't matter. And so we really need to stick to data that matters, which is data that is accurate, that is timely, is actionable, and it must be large enough to represent a region with numbers where your conclusions can have some sort of ability for us to make decisions based on that. That's county data, state data. It could be a region like New York City where there's a large number of people. But the total daily, so there's only really 3 pieces of information that I think we should be looking at if we really want information that is accurate, timely, and actionable. One would be the total daily census or number of COVID inpatients at any one time. If you see that number is starting to plateau or start to drop, then you know that we've finally gotten past the worst of this. We could also look at the total number of COVID-related deaths per day, not the accumulated number of deaths per day. If on a regular basis we're starting to see that the per day number of deaths are dropping, you know that we're finally getting past this. And the final number, and the statisticians have variations of the 3 things I'm talking about now, but the total number of COVID admissions per day is probably, of all the 3 that I said, the most accurate, timely, and actionable, because that's real time. Clearly, people in the hospital can come through diseases at all different rates. So the total census per day, which is a good number, varies depending upon how quickly or how long it takes for you to get through the disease. And I already mentioned earlier the problems with some of the death data. So the total number of daily admissions per hospital per day is probably our most accurate, up-to-date, timely picture of where we are at any one time. So with all of that as a backdrop, let's look at our East Brunswick data. The first slide that you're going to see showing up on the screen is our cases per day. And if you take a 40,000-foot view at the graph, you'll see that the numbers are actually starting to, on a grand scale, going up from the time we started testing on March 15th to today, April 15th. However, there's a lot of reasons why you could be seeing a lot of newer COVID diagnoses. One, we're doing more testing. Clearly, in the beginning, we didn't have enough tests out there, so only a handful of people got testing. And so the fact that there were so few cases really is a reflection of that there was just so few people able to get the test to begin with. And now that there's more people testing, I don't know if our larger number is a reflection of more people being tested, or are there really more people with disease? The other thing that you could look at from this data is that it clearly goes up and down and it scatters. That's a reflection of the fact that one day we can get 2 cases, the next day we have 41, the next day we're down to 8. all is a function of the rate at which we get information from the county. And I already spoke earlier about how many of those processes leave much to be desired, and that's why our data just for East Brunswick on any one day's basis isn't really very helpful. The next slide that you're going to see is the COVID hospitalization rate, the percentage of people who were diagnosed with COVID who were in the hospital. Now, again, also inaccurate information and nothing that you can make a conclusion on, because you can see from the diagram, 87% of those people who were diagnosed with COVID were staying at home and 13% went to the hospital. But that's at any one point in time. I don't know whether some of those people who were originally diagnosed at home ended up in the hospital or not. It was also heavily skewed towards the number of people that were given tests in the beginning were clearly the sickest. So that's why most of them, or many of them, ended up in the hospital. And more recently, we've gotten so many more cases that the county isn't even telling us if the patient was in the hospital or not. So our data is skewed towards the information we got from the very beginning of the information being provided to us. So clearly, if 13% of every person diagnosed with COVID ended up at the hospital, there's not enough hospital beds in the whole country to handle that. So the next slide is going to look at gender breakdown. And in all honesty, you see that the 17% unknown is simply because the county isn't always giving us information with that filled in, so we just don't know. Even if I divided that 17% up, half men, half women, we can see that it has actually shown to be a virus that seems to be affecting more men than women, and national statistics tend to bear that out as well. But I don't know what I would make of that for 269 data points. The last slide that's going to show up is going to be data based on age groups. And if you look at that graph, or the bar curves, you'll see that the largest age group that of East Brunswick residents, of our 269 somewhat cases, is in the 51 to age 60 age group. In fact, the other thing that stands out on the page that was surprising somewhat to me was the fact that we have actually less cases in the age group of people that are 70 and older than we have in those people that are 21 to 40. There's clearly more people in that group. So what does that even mean? Could mean a bunch of things. One, it could mean that the people that are seniors in our community are actually heeding instructions and they're staying indoors, and therefore, since they're doing what they're being instructed to do, we're seeing less cases in that age group. Could also be that the people in the age 51 to age 60 age group may actually represent the largest group of people that live here. Back in 2010, when they did the census at that time, the largest age group in East Brunswick was those aged 45 to 55. So assuming nothing changed and nobody moved in and nobody left, 10 years later, the largest age group would be 55 to 65. Now, I know that that's not true. New people have moved in, and we're about to, in the process right now of undergoing a census, and that data hopefully will be available in the next year or two. But clearly, the fact that more people live in these are here living in those age groups may represent the reason why more of them have tested positive. Is it possible also that many of the younger people in the community aren't really heeding the instructions, and therefore they're getting more disease than we would have expected from data from other countries? Is it possible that in this country more young people are getting COVID than in other countries? This is something that we really don't have the answer for right now. I know in a couple of years when we look back at all this data, it'll seem crystal clear. But right now, it's just not really crystal clear. But this is the information for East Brunswick as we have it. And it's the reason why I haven't spent time going out on in public trying to convince you on a daily rate a day what our data is, because it really doesn't follow all of the characteristics that I said from the beginning, being accurate, timely, and actionable for us on a daily basis. It becomes more important that if you really feel compelled to follow daily data, you can go into the home news. They list pretty much every day what Middlesex County, and it breaks it down by township. They also list it on the county website, its Facebook page, its Twitter page. Breaks down the county, and it breaks it down by city if that's important to you. But please don't expect me to give you daily updates of cases, because I think I've made my case why that's not very helpful. But for now, I will continue to keep the township updated regularly with information and data that's useful. In the meantime, I would like to thank, again, all of our first responders, our healthcare workers, our essential workers, who really are the heroes for this entire pandemic. I'd also like to thank the many, many, many residents of the township who've donated PPE, food, supplies for our healthcare workers and our first responders, for our EB police department. I've also like to thank everybody who's been providing useful and entertaining programming on Facebook Lives, on Zoom, and other virtual formats for the public while we're all stuck at home. Kudos to the East Brunswick Parks and Recreation Department, to our East Brunswick Public Library, Human Relations Council, which put on a Zoom program last night, and all the others who've produced many of these programs. Also like to thank all the residents who've contributed, whether in time, in effort, or in money, in their own way, to helping those who are less fortunate, those who are older, those who are disabled. I'd like everybody to remain calm, because we are going to get through this. We're going to get through this together, I promise. So with that being said, please enjoy the spring, take a walk, enjoy our parks, relish your time with your families, and most of all, stay safe.